some folks just hate the idea that the government provides money to people to get their health care. That's a philosophical issue that's never going to go away for certain individuals. But the blunt facts is that it has expanded care and people are getting better health care because of the Affordable Care Act. I think the policy is sustainable. I think the larger discussion around the federal government being able to continue to fund state expansion of Medicaid is a big open question. State budgets are driven by the economy of the citizens that live in the state, and if states experience significant unemployment or other economic declines, that could be a problem for states being able to continue to fund their fair share. But in the long term, I think that the expansion of Medicaid through the Affordable Care Act is sustainable and will frankly be retained regardless of some of the politics that are currently underlying its expansion. One of the reasons that healthcare is so expensive is that for years, providers were not being reimbursed for people seeking care that didn't have insurance. So their prices went up, and then the insurance premiums went up as well. And I think stopping that cycle over the long term will help sustain the cost increase over the next 10 to 15 years. So everyone's in the pool if they want to be. For those skeptics who say, well, we can't continue this, I push back and say we have to continue because long term, everyone being in the pool and participating financially is foundational to controlling the rate of healthcare cost increase. Now that underwriting has been eliminated, it allows people to access insurance regardless of whether they've had a catastrophic medical event. What that is doing is driving up the insurance premiums in the commercial market because the companies have to cover the risk now for those who would previously not be insured in the past. I think it's fair and reasonable to ask consumers to pay part of their cost because if I don't pay anything, I don't respect the insurance and I may just simply overutilize it. So I make wiser choices when I have my own financial skin in the game. The idea really is underlying this whole discussion is what's personal accountability for my health care? And if something's free, do I really like it and will I use it best? And I think that's the discussion that most Americans want to have. A healthy lifestyle does improve health. But if you do have bad genes and you have a lot of illness, that's a challenge and you have to get care for that and someone has to pay for it.